The outbreak of COVID-19, which began in China in December, has since migrated across borders and oceans to at least 47 countries and has resulted in nearly 3,000 global fatalities. World stock market tanked over the economic failure resulting from the spread of the virus. Here are do's and don'ts to help you protect yourself, as suggested by medical and public health authorities. Don't touch your face. Medical advisories from the World Health Organization has reminded us time and again to touch our face, nose and mouth too often. This helps reduce the chance of catching the virus as infection from your hands don't reach the nose or mouth from where it can infect the body. Keeping your hands clean will also help reduce the chance of the infection spreading any further. Don't go to crowded places. Public transport, metros, gyms, and any other crowded places should be avoided. The more the number of people, the more likely of the spread of the virus. If you have symptoms, self-quarantine yourself other than to visit the doctor. Staying isolated and not coming in contact with a lot of people is the only way to contain the spread of the disease. Don't believe everything on internet. The internet is filled with information about the symptoms and cure available for coronavirus. Don't believe anything unless it comes from a reliable source or a reliable medical practitioner. Spreading false information and promises about the cure for the disease has added to the panic and kept a large percentage of the population misinformed. Advertisements about health kits and alternative ways to cure the infection are also doing the round of the internet. Don't fall into the trap yourself or propagate any information that is not from a reliable source.
Continue the presentation. Now I will explain about what you saw during the COVID-19 pandemic. First, reduce your stress. Countless studies have shown a correlation between stress and reduced immunity. Next, speaking of strengthening immunity, get a flu shot if you haven't. It's not too late. Next, maintain a diet and sleep pattern. Take care of yourself by eating several servings of fruit and vegetables daily, drinking at least 8 glasses of daily water, and getting 8 hours of sleep. Next, wash your hand. Wash your hand often for at least 20 seconds with soap and water or an alcohol or hand sanitizer. Don't wash just the palm and backs, but get in the crevice of the finger. Be thorough. Next, cough into your sleeve or a tissue, not your hand. Next, avoid people who appear ill if possible. If you're in a crowd space and someone is coughing, turn your back. It's not rude. It's smart. Try to put at least 6 feet between yourself and someone who has some similar to that of the flu. Next, clean areas in your home, room, and any shared area that you touch often, such as door and sink handles and toilets, phones, computers, and water bottles. Next, if you have a cold with fever, stay home or in your room. Contact your healthcare provider and remain isolated until you are without fever or the use of fever reducing medicines for 24 hours. Next, buy a surgical mask if you are sneezing or coughing. Do not have a fever. Next, remember to make backup plans. If your children's school closes, do you have contingent childcare ready? Do you have a plan B for working if public transit cuts back because of health concern? Or if you have to stay late at work? Next, over support and kindness to classmates and colleagues who might be affected by the coronavirus. The outbreak has spread anti-ASEAN prejudice. Okay, so many presentation about COVID-19, what you should and shouldn't do now. Thank you.